Hello, I'm Dr. Paul Beckham from All Seasons Full Body Chiropractic Center in Fargo, North Dakota. We're answering patients' frequently asked questions. And one of the questions we get is, how long until I feel better? Well, most patients, some might expect to feel better after one treatment. Usually that's not the case. Most people, even after their first treatment, usually are going to feel a bit achy and sore because we're getting some things moving most of the time that haven't been moving for a while. So a lot of people are going to experience kind of an exercise kind of soreness is really the best way to kind of describe it. That can last anywhere from 2 days out to 2 weeks, but usually it kind of peaks out at about that second or third day, usually mostly an achy soreness. It shouldn't be a sharp stabbing pain at all or anything like that. And continue to taper off just like an exercise program. And the more you exercise, the more you get moving and all that sort of stuff, the better and better it's going to get here. So the other big factor in there is depending on what kinds of tissues are involved. Typically, if it's kind of bone and joint, a lot of people are going to really start to feel pretty good after a couple of weeks of treatment. Generally, again, you should be feeling better and better, as we're getting you treated here. That's just one thing that we're measuring here in the office. We have multiple different testing things that we look at that a lot of them are computerized. So we can measure things like range of motion, posture, alignment, functional movement. I mean, there's just tons of different things besides pain. If you have more muscular type pain, typically that can maybe take, 4 weeks is before you're really starting to feel pretty good with it there. Could even stretch out to 12 weeks there. Think of anything that you might have had happen in a high school athletic event or even in sports. You're probably looking at a good 4 to 12 weeks there, before you can kind of get back to almost normal activities again. Typically, if you're having something more like a nerve type problem, it could take like 6 weeks out to even 6 months. I mean, I have patients that have, simple or very mild cases of nerve problems. That's on the 6 week end of the spectrum, where patients that have a disc herniation that's facing a nerve root or something like that, causing a radiating pain or something like that, going down their arm or their leg, that can take even up to 6 months. I've had patients that are just like that. A lot of them we've had set up for MRIs and CAT scans. We even get them set up with a neurosurgeon, but a lot of times, they're continuing to get better and better all the time. It's not like you're going to see progress here. So, those are the typical things that we kind of see here. So, I guess if you have any other questions, you please feel free to contact us and we'll try and even include those in the videos that we're shooting here now. So, have a great day.